Thank you, Mr. Chairman. I just think it's outrageous that we're holding this hearing today instead of talking about what is actually happening in this building right now. An effort to rewrite the rules that concern 1/6 of this country's economy. An effort to jam down the throats of the House and the Senate the repeal of the Affordable Care Act, the most massive change in American healthcare in our entire lifetime. And we aren't talking about it in the Health Committee. We're the Health Committee. We are charged with overseeing the American healthcare system. And we are acting as if this isn't happening. I mean, PDUFA, MDUFA, I understand they're important, but I'm just going to tell you, the people that are sitting in this audience today, they're not representing uninsured Americans. They're representing the industry by and large. They're representing the million and billion dollar companies that have a lot at stake in this legislation. We're the Health Committee, and I don't know what the relevance of sitting on this committee is if we have nothing to do or say about a piece of legislation that is going to dramatically alter the landscape of American healthcare for our constituents. We've heard about what the Health Committee has done in the past, and so I won't regurgitate those numbers, but I watched those hearings. I was proud to watch those hearings. In the Health Committee, there were 300 amendments that were considered in developing the ACA. There were 160 Republican amendments that were accepted as part of that legislation. Republicans didn't vote for it in the end, but this committee had the chance to weigh in. The American people got to see over the course of a year an actual debate play out. And though Republicans eviscerated Democrats for ramming that bill through, let's be honest about why we're not having a hearing here today. It's because my Republican colleagues didn't learn a lesson of a bill being rammed through the process. They actually think that process took too long. And so the reason that this bill is being jammed through at on an extraordinary time frame is because the lesson they learned from the ACA is that there was too much debate. And so they want less so that nobody can see what's in this bill. I get that we can make your job easier and speed more transformational drugs to market. But if you don't have insurance to afford these drugs, then nothing we do here in the reform of these user fee agreements matters. 24 million people are about to lose their health care. That is the entire population of Alaska, Delaware, Hawaii, Idaho, Kansas, Maine, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Rhode Island, South Dakota, Vermont, West Virginia, and Wyoming. This isn't a minor adjustment of the number of people who have access to the drugs that we're talking about here today. This is a humanitarian catastrophe that is about to happen, and we are pretending like the debate doesn't exist. I asked to be on this committee because I wanted to be at the center of the most important debates about the future of the American healthcare system. But it is possible that next week in the United States Senate, we are going to be asked in a handful of hours to vote up or down on a bill that is going to dramatically change the reality of healthcare consumers all across this country, driving rates up for millions of people, especially older Americans, taking health care away from millions of Americans, passing on enormous tax breaks to the drug industries that we're talking about here today, to healthcare insurance companies. And this committee will have nothing to say about it. I don't have any questions for the witnesses.